This video is going to be on a subject that I've intended on making for a long time. I kind of answered it. I touched on it in a previous video where someone asked me a series of questions, and one of them was about the VA. And I said I was going to expand on it on a later video, which I haven't yet. Other subjects keep popping up to um, take up time, and I haven't. And I met a soldier today at lunch. We were talking and stuff, and it just reminded me that I had yet to make my official VA video. So that's what this is. First of all, a little bit of history, and I want to do this context to because of all the problems that's in the VA. These problems have been around since, well, I can remember in the early 70s. I've always heard family and friends of my parents talking back in the 70s of the issues, the problems they had at the VA. And these problems, I think, relate to probably a fairly specific reason other than just being a government organization. And we all know the government organizations. The VA was started between the two world wars to take care of our veterans. Uh, they did a pretty fair job, pretty good job in the 40s, 50s, and the early 60s. I don't remember hearing a lot about discrepancies and problems with them during that time period. Not saying there wasn't, I just don't ever remember hearing anybody talk about it. What I want to put a perspective on is the scenarios that I think has contributed to some of the problems. Now, this is in a way a defense of the VA, but it's not really a true defense of the problems we currently have in the VA. After World War II, or during World War II, the VA geared up for the huge number of veterans that they were going to have post war. And with Korea only a few short years after the end of World War II, the VA's facilities, it grew the number of hospitals and clinics and stuff to be able to effectively handle that number of veterans and to be able to take care of them. Now, of course, that whole time period was a growing spurt because they were building. They just started in 1930, and so they were building hospitals and facilities, and they placed them around the country. That after World War II probably was the best time to see where they needed to put stuff. So, and what I see is they kind of got into, they developed the program around the injuries and the people, the number of people post World War II. So they had the World War One veterans, World War II, and then they had the Korean veterans. And they got into a routine of dealing with that number of people and the injuries that they had. Then you had Vietnam. And starting in the late 60s, early 70s, they got a deluge of new patients with totally different injuries and problems. And they were staffed for the World War One, World War II Korea vets. They wasn't really staffed. They didn't have the number of personnel or the specialty people they needed to handle the Vietnam vets. So you had an adjustment period through the 70s and the 80s up into the early 90s where they were able to adjust their staffing in order to handle these people. On top of the previous World War One, II, and Korea vets. By the 90s, the VA had kind of got things worked out. Yes, there were still problems, but they had pretty much got everything worked out. Now with the Desert Storm vets, you had a whole different problem with the Desert Storm vets, and that's the ones that were actually over there who breathed in the oil fumes and that stuff and the diseases that created. But it didn't overwhelm them. They were able to get on it quick, handle it quick, and I think the VA did a fairly well job. Then you had 9/11. And over the past 17 years, 16 and a half, almost 17, we have had a whole new huge influx of wounded veterans. Everything from physical wounds, brain trauma, the increase in number of PTSD patients, and that has overwhelmed the VA. They're still trying to take care of the other veterans, and now they're trying to implement these veterans. And I think it's just a matter of the fact that the VA is overwhelmed. Now, that's not an excuse for some of the things that we've seen in the media of what's happened. But at the same time, again, they got into a routine, and then all of a sudden they got all this new influx. And like anything else, I give you an example. So, say you're a medical facility that handles an average of 100 patients a week. You get into a routine for 10 years, you've had an average of 100 patients a week. And then out of the blue, all of a sudden, you get 200 to 300 a week. And it stays there. It takes a transition period. It takes a time to, and these new 100, 200 patients that you haven't had before, they have totally different medical needs. So you've prepared yourself, you've hired the people that would take care of the current patient load. 100 patients a week, so you got the number of people that would handle it, and the needs of those 100 patients. Now you've got this 100 to 200 more patients a week that you've never had before, and they've got different problems, and you can't handle them. So that's an example of how I see the VA. Okay. What needs to be done to fix it? Well, one, there needs to be a structural review. All right, there's 3 points that I think needs to be addressed to fix it. One is a scenario that has to be done, and 2 is what do we need to look at that would help fix it. And number 3 would be basically a combination. All right. So let's address the first part first. What has to be done? If you go back to my budget and where I talk about restructuring the government, the VA is a part of that. Doing a grounds up evaluation of all the VA facilities, the personnel in the facilities, and making sure that every facility has been staffed properly. That's got to be done first priority. All right. Just a minute ago, I was thinking of something else that goes in with that group, and I totally just blanked out. I apologize for that. So let's move on to the second, maybe the other part of the first one. The second part is a series of things that I've been looking at that we need to look into. All right. With this group, what we want to do is evaluate each of these things on 2 bases. One is the most effective ability to take care of our vets. And number 2 is financially, how can we afford to do these? Obviously, we want to spend the money needed to make sure our vets are taken care of. But at the same time, we can't go overboard with the spending. If we set up a situation or a plan that will do 100% take care of the vets, but it's so cost effective, it's so cost expensive that there's just no money in the budget for it, then we're not going to be able to do it. So we need a plan that's going to do the most for the vets within a reasonable cost. Okay, I do not always buy into the idea of the least expensive way of doing things. I also do not buy into the idea of the most expensive way. Most of the times in everything you do, and I want to use normal life, car insurance, mechanics, body shops, contractors to build your house, the cheapest guy is not always going to be the best, and neither is the most expensive. Most of the time, 75-80% of the time, the person kind of in between those two is going to be the best. So you're going to get the best quality for the reasonable price. And that's what we need to look at. So my ideas about how the vets, the VA can work things out to help out. Well, first of all, I believe the veterans should be allowed to use base facilities. And what I mean by this, and I'll give you the two examples I talk about, is Camp Lejeune, or Jacksonville, North Carolina, and Columbus, Georgia, Phoenix City, Alabama metropolitan area. Camp Lejeune is right there in Jacksonville, largest Marine base on the East Coast, and there's no VA hospital there. Now we can talk about that in Oceanside, California too, Camp Pendleton. There's no VA hospital in Oceanside, California, or San Clemente, California. One is on the south side of the base, one's on the north side of the base. The closest VA hospital to Camp Pendleton, I believe, is in San Diego. The closest VA hospital to Jacksonville, North Carolina, Camp Lejeune, is at Fort Bragg, North Carolina, Fayetteville. The closest hospital to Fort Benning. Fort Benning is the second largest military installation in the United States. The closest VA hospital to Fort Benning is in Tuskegee, Alabama, an hour away. All right, all of these facilities are at least an hour away from the bases. Now, when you have facilities like this, you have a huge number of the civilian population around those towns that are either retirees or veterans. But they have to go an hour away to a VA hospital. Now, most of these places has an outpatient clinic, in other words, a first aid station. But they do not have a hospital. Okay, they have the civilian hospital, but not a VA. And I'm not proposing that we put a VA hospital in the town outside of every military base. To me, that's a waste of money. But what you do have is every military installation has a base hospital. Unfortunately, the only people allowed to use that hospital are the active duty personnel stationed there. My whole point of that is, why not allow the retirees and the veterans to use that facility? If there's no hospital, VA hospital, now like Augusta, Georgia. Augusta, Georgia has Fort Gordon. And Augusta, Georgia also has a VA hospital. So, yes, all the veterans and retirees that live in Augusta can go to the VA hospital there. So they don't need to use the base facilities. But at Jacksonville, North Carolina, Columbus, Phoenix City, Alabama area, and Oceanside, California, those are just three examples I can give you. Why can't the veterans go use the base hospitals? To me, that would make more sense. The base hospitals are already fully staffed. It's already figured in the military budget. It's not going to cost us anything extra. Let's let the veterans go use that facility. What this is going to do is it will relieve the workload. See, what I talked about, this is the reason why I started this video with what I did, talking about how the VA workload is if we could relieve the workload of some of these VA hospitals, you could increase the amount of care. It's like, for example, let's say, for example, that the acceptable workload is 10 patients per healthcare provider. I don't know what it is. We're just going to use that as an example. So let's say it's 10 patients per healthcare provider. Some of these facilities, you have 20 or 30 patients per healthcare provider. So by opening up the opportunity for these people to use the base facilities like that, you could lessen the workload on those providers. And anytime you bring that workload back down to what's within the acceptable standards, whatever it is, then you're going to increase the care of those patients. In that same aspect, you have the reserves and active duty, or reserves and National Guard personnel, who has to do 1 week in a month, 2 weeks of active duty a year. Well, during their 2 week annual training, why not have them assigned to the VA hospitals around the country? That would, now, when I say we're going to restructure the government and the VA is going to be restructured, the restructuring is going to be to staff these facilities with the personnel that they need to handle the patients. If we put in the reserves and National Guard, they're going to be in addition to that. So again, that's a way of bringing down the workload. Those 1, 2, maybe even 10 extra people on a regular basis, you may not be able to have those extra people there every single week. You may have them there this week and not next week, and then you may have them 2 or 3, 4 weeks in a row. It just depends on the rotation of the reserves and National Guard units and how it can be worked out. But when you do that, again, you're going to bring down the workload on those healthcare providers in the VA hospitals. Anytime you can lessen the workload, you're going to have better patient care. Additionally, by implementing the reserves and National Guards, you've got military serving veterans. And you know dang good and well they're going to look out for their fellow veterans. So that's something I think we need to research. Another part of the research group is health insurance for veterans. The retirees, when you retire, you are enrolled in TRICARE. Now, it's a health insurance program for retirees. You do pay into it, I believe. I did forget to look that up before I started making the video, so I apologize. But it is an extremely discounted, if it is paid for, it's extremely discounted healthcare system, health insurance system that's strictly for retirees. Why not expand that to all veterans? When you leave active service, no matter whether you're a retiree or not, you have the option to enroll in TRICARE. Therefore, you're covered by the same health insurance that all the retirees are. And that health insurance can be used at any civilian facility. So therefore, you don't have to go to a VA hospital. You can go to, when you move home, you can get you a local doctor and a local facility, and your health care through the VA covers the cost of your health care. And that right there will also, if that is something that we can afford to do, that in addition to the staffing is going to reduce the workload on some of these facilities. All of this is going to do nothing more than increase the care of our veterans. That's the number one point. That's the whole point of the VA, is to take care of the veterans who took care of us. Okay? Another thing to be researched is, like here in Southern Ohio, I'm from Adams County. There's no VA facilities close to me. All right, there's 3 VA hospitals in the Southern Ohio area, and that's Cincinnati, Chillicothe, Ohio, and over in Huntington, West Virginia. Now, Portsmouth, Ohio has a outpatient clinic. Okay, I grew up in Adams County. Okay, it's 45 minutes to go to Portsmouth, hour and a half to 2 hours to go to the VA hospital in Cincinnati, hour and a half to 2 hours to get to the VA hospital in Chillicothe, and if I was to go to the VA hospital in Huntington, it's an hour and a half to get to there. Or, like I said, 45 minutes to get to the outpatient clinic in Portsmouth. Okay? Why not, for people who live in those scenarios, why not just have them use their local facilities and the VA pays for it? If I was living in back where I grew up at in Lynx, and I had a heart problem and I had to go to the local hospital for my heart problem, then they would bill the VA and the VA would pay for it. Okay, now that kind of falls under the TRICARE, I guess you could say. But it's something to be looked at. That's three scenarios. Those are the three things that I think needs to be researched the most as to help improve VA healthcare. And like I said, the third group is basically a combination of this, of the first two. The staffing along with the VA. So those, now the first group, which is the staffing part, has got to be done. It will be done when I get to Washington, when I get in the Senate, and we go to restructure the government. That's a part of the government restructuring, is doing a complete overhaul of the VA itself and its personnel. Okay, establishing the personnel needed per facility, evaluating what they have, getting in people that they have, and I'm going to be honest with you. This kind of goes along with the government in general, which the government union is not going to like me much on. But getting rid of this part about how we can fire people. And this is going to kind of lead into another video about all the uproar right now with President Trump and his shakeup of the White House. In private business, if you don't do your job, you get fired. That's simple. And that's the way things are in the White House right now. That's why all the liberal media's heads are exploding over the way President Trump is. Well, he got rid of Secretary Tiller and all this stuff, and guy wasn't doing his job. He wasn't in line with company policy. And if you're not in line with company policy, the company I work for, the owner of the company himself taught me this is how I want my stores operated. And I had one of two things I could do. I could either go in and make the managers follow company policy and do it the way the owner taught me. And if I did that, I got to keep my job. Or I could go in there and say, well, I want to do it the way I want to do it, and lie and falsify things, kind of like the VA. And as soon as I got caught, I got fired. There was none of this, well, we got to keep them on, and we got to do, no. If I got caught, out the door. See you, buddy. Go find someplace else to act that way at. And I think we need a little bit more of that in the government. These people out in Phoenix, that's where all this stuff really come to head at a couple years ago. You had some of them, and I think there still is some of them still working for the VA. And they should have been fired freaking as soon as the information come out and they got caught lying and doing cheating and things like that. They should have been terminated right then. So that's something that we need to do, but that needs to be done government-wide. And that's a whole different subject, but that's what needs to be done. So in the restructuring of the government, we need to evaluate that. Look at the VA, look at the people that we have, restructure it to where it's a more efficient reporting system. One thing I thought about too is these people, part of what they lied about is to get their bonuses. They lied about the number of people seen, the speed of from the time someone called in for an appointment until they actually got looked at their appointment, because their bonuses are based off of that. I got a better idea. Let's set up a central website for all veterans to go onto. And the veterans log that information in. Not the people in the facilities, but a veteran goes on there and says, on January 2nd, I contacted such and such facility for this medical reason. And I didn't get in to be seen until March 30th. There goes the bonus. If we had the veterans, the patients themselves, telling us this is how this facility is operating, and we're not going to have the line. We don't need, that would be like the owner of the company that I work for having the manager go through and do the supervisor's evaluation for them. Cleanliness of the shop, quality of the work. Of course, he's going to go through and mark all the boxes. Great, 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 great. And I walk in the store and it's got trash piles so daggone high you can't walk. That's how it is with the VA. You got the people in the VA and the government writing their own evaluations about how well they're doing their jobs so they can get a bonus. So let's turn it around. Let's put the bonus based off of the evaluations of the veterans. And that right there, you're going to see an improvement as well. If they want that extra money, they're going to make sure that the veterans are getting in for their appointments, that they're getting taken care of. So we have a whole bunch of things to evaluate. And some of this stuff does have to be evaluated because some of the stuff is about the cost. Which way with the health insurance and the local facilities and using base facilities. Of course, you got to set up, a limit how far away from the facility they live and all this other stuff. But let's research this. Let's take this into consideration. Let's figure it into our budget. And let's make something like this happen because these are the things that will help take care of our veterans. Thank you.